If you have active warts, woman has active warts, could this be an issue if she is pregnant, and can the virus then be passed on to the child?
The virus per se is not something that passes on from, there's some cases of oral cancer and oral papillomavirus that was described early in the literature associated with giving birth through the vaginal canal when you had HPV infection. Now, we know the majority of children, even if the mom has HPV lesions or is tested HPV positive, is not going to develop any type of infection. Unless you have a very large and condensed ward at the cervical canal, most likely that's not going to be something that's going to cause any type of injury.
Is there treatment for HPV, or does it simply, or can it go away on its own?
The majority of the HPV, your immune system could get rid of it with time, but the treatment now is a preventive treatment, given the medications and the vaccines prior to the development of the HPV. And then what you do is, especially with cervical dysplasia, cervical cancer, is that you follow and treat the conditions that HPV causes. You treat the HPV dysplasia, the cervical cancer, and so on, based on that.
Let's talk about vaccines for a moment, because, doctor, in this day and age, for whatever reason, there seem to be a lot of misconceptions about vaccines in general. So with regard to this vaccine, what are some of the common misconceptions here? And then what advice do you have for patients who simply say, I'm not sure I want to get vaccinated?
Well, I think that the data at this moment is quite safe. This vaccine been around for a while, and the side effects are very, very limited. So, and it's more like a local side effects or some type of bruising and all that. We don't tend to see any large side effects or any severe consequence secondary to this vaccine. I think that the majority of misconception with vaccines in general is that people feel that somehow they're getting the virus inoculated on them, and that's a live virus. Majority of vaccines don't have a live virus with them. Therefore, they're not going to get the disease with the vaccine, and this could apply for the flu vaccine and all the other vaccines that are out there. Very rarely, vaccines have a live virus in it. Most likely, there's an attenuated virus, and that's not going to cause any infection.